who is the Conservative MP for Enfield North. Thank you for talking to us. Your boss has really let you down on this one, hasn't he?
Well, I totally disagree with this decision. I think the IRP report was wrong, and I'll explain why. And I think it was wrong for the Secretary of State to endorse it. So I make no bones about that. I'm hugely disappointed, as I'm sure many of my constituents are.
You've supported David Cameron on the wider picture of NHS reforms. Given he's not gone your way on this one when he vowed to support not making the changes at Chase Farm, will you now pull back that support for the bigger picture? No,
not at all. And in fact, I am of the opinion that one of the reasons I'm critical of the IRP report was that, in fact, under the reforms, we have the opportunity for robust GP commissioning and empowered local decision-making to design our local services. Unfortunately, at the time the IRP were looking at this, they were looking at a scenario where, with the best intentions in the world, our GP commissioning was by definition not very robust. It was just underway. And I'm afraid the council as well, unfortunately, produced a report that, as they said, didn't really present a credible alternative. And I think, given that we were at this early stage in the reshaping of who designs our services, we should have had time to actually put up a credible alternative.
OK, and that hasn't happened. The battle is all but lost, really. We've now being told that patients, residents there will get an urgent care centre. What is your understanding of what that will be?
Well, I think there's one thing that you're not reporting, which I think is very important, and it will help define exactly that point, is that I've been calling for, and the Secretary of State agreed, that NHS London have to report urgently on whether we can have a divorce of Chase Farm from Barnet Hospital and have them merge, hopefully as a new foundation trust, with North Mids. Now, what this means, to answer your question, is that any sale of any land, and there's excess land at Chase Farm, would be ploughed back into our local health economy under the new trust, and a powerful established GP commissioning body would then be free to design the services based on local needs with the help of that additional funding as well. And I believe it's down to GPs then to decide the exact shape and nature of what we do have both in primary care and in secondary care.
OK, that's a request for the long term. Very briefly, what's your message tonight to any families who are listening who are worried about particularly the state of midwifery services in London and what that will mean if they live in this particular area?
Well, again, my understanding is that that is slightly premature and no final decision has been taken on that. But as I do agree, it doesn't look particularly good that we may lose our consultant-led maternity services. And my response to that is that we shall have to explore every avenue to make sure that the future GP commissioning groups, in the short term, and it's not long term, design services that meet the patient needs. And that's what I'm hoping for and that's what I'm expecting.
OK, Nick Dubois, thank you for talking to us on London Tonight. Thank you very much.
Thank you.